Welcome. I'm Greg Stevens. I'm the chair of the Department of Public Health. I just want to say thank you to everyone who's joining us in person and online today for this third and final installment of our Healthcare in the 2024 election series. Our department hosts these events to not only bring expertise and insight into our community, but we do this to bring our community together. We all know how important it is to form strong relationships between students, alumni, faculty, and staff. And we know how important it is to be together during difficult times. For many people in our community, the election last week and what's beginning to unfold over the past few days is undoubtedly a difficult time. And I'd say our webinar today is by far our most challenging. Earlier in the semester, we hosted two other speakers, Larry Levitt of the Kaiser Family Foundation and Pulitzer Prize winning journalist from the LA Times, Michael Hiltzik. Both of them are great speakers, but they got to enjoy a little bit of crystal balling about the future of healthcare and public health and what was going to happen after the election. But today, we know the election results. I'm glad that you're all here, both in person and online, whether you're a Trump or a Harris supporter. There's one thing that's clear. We have a lot of important public health work ahead of us. I'm thrilled to begin the conversation today about that work ahead. And I just want to prep folks that our speaker, Julie Rovner, hasn't shown up for this webinar quite yet. We're assuming there's an emergency. We're working to get her online. But I'm going to hand it over to Dr. Walter Zelman, a former chair of the Department of Public Health and professor in our department. Also, Dr. Taylor Dark, who's the current chair of the Department of Political Science. And Dr. Joelle Wolstein will join us from the Department of Public Health in just a minute. So thank you, gentlemen and ladies, and I'm looking forward to the conversation. Walter.
Hey, thank you, Greg. Nice to, I was going to say see you all, but I can't see you all. But it's nice to be here. Thanks for joining us for our, as Greg said, our third webinar. We are trying to contact our guest. I have a feeling that our guest got called into an emergency session. She's a top journalist in Washington. And if you've been watching your news feed, wherever you get it in the last few hours, you saw something that I think most of us found a little on the shocking side, which is apparently Robert Kennedy, the son of Robert Kennedy, Robert Kennedy Jr. now, is contemplating or has been asked by Trump to run the health department in Washington, D.C., which would include public health. And since he is the best known anti-vaxxer, let's say he doesn't completely oppose vaccination, but he's as far as you get amongst the people we know or would have listened to, he's pretty far out in terms of being an anti-vaxxer, and Trump is thinking of appointing him as the chief health officer, in effect, of the United States. It's pretty much a stunner. So there are a lot of ways to look at it, but I'm going to ask Taylor Dark from the Department of Political Science to start us off and give us a sense of what do you make of this? How extreme is this? I mean, a lot of us are kind of stunned by some of Trump's appointments already, but this one really is going much further.
Yeah. Well, I mean, this is really a fascinating period of American politics right now. And, what I find really interesting about it is that really for both parties, it represent this a coalition of interests, of usually a powerful interest groups. Both parties have, businesses and corporations that are allied with them. Plus you have labor unions, for example, the Democratic Party. And usually when you make appointments for the like this level to cabinet secretaries for the departments, those interests are served in some way. So you would expect that for HHS, the Department of Health and Human Services, the president has announced that he's going to nominate RFK for that position. Normally that job would go to somebody who has the approval of these powerful interests. And I don't think he has the approval of any powerful interests at all. I mean, I don't think he's got the approval of the Democratic aligned interests in the health field, healthcare space. But I don't think he has the support of the traditional Republican interests, the pharmaceutical industries or other industries, the private health insurance companies or whomever. He has no base really, outside maybe a small, certain group of supporters in the electorate, and kind of MAGA field. And so he's now being potentially thrust into that office. And so it's remarkable to see a president who's just kind of seems to be untied from and disconnected from traditional interest group alignments. I mean, you see the same thing, with uh, some of his other appointments. This guy for the Department of Defense, whose name I can't even remember, who also has no real connections to interest groups or experience. And so that's fascinating that he would choose somebody who was so disconnected from his traditional interests. And then also, just to finish, the other thing that's interesting is that it's questionable whether he has the managerial experience to deal with such a complex entity. But I mean, you can, in theory, hire people to help you with that. So we have our speaker here now, so I will now
Great.
defer to Julie Rovner.
Julie, how are you? I haven't seen you in a long time.
It's
Nice.
been a little bit nuts today. Can you guys hear me?
Yeah, we can hear you.
Okay.
You know what our first question is? We had
Yeah.
a set of questions, but our first question is, what do you think? What does this mean? How could this happen? And anything, what can you tell our audience about what is going on here?
I think this is Trump's equivalent of shock and awe. I mean, I think this is of a piece that goes with Matt Gaetz and Tulsi Gabbard and Pete Hegseth, if that's his name, the guy from Fox for Defense, that he's trying to shake things up so much that nobody knows where to point. I tweeted a few hours ago, I said the winner of the week is Kristi Noem, because nobody's even talking about her anymore. He's just going to throw so much at once. I mean, this is the polar opposite of 4 years ago when there was no transition, when he fired Chris Christie, what a day into it, and they couldn't name anybody. This is literally just the opposite of just throwing as much shocking stuff up as possible so nobody can concentrate. And you turn on cable news and they're all talking about 2 names ago. They all have to switch. It's real. I mean, forgive me that I completely lost track of time because of this. It's been like this for the last 2 days.
And what do you think it might mean in terms of how he will govern? Is this an ongoing style? I mean, you can't continue this for 4 years. At some point.
Oh, I don't know. The 4 years between 2017 and 2021 were pretty crazy. I think the reaction of a lot of reporters, health reporters, and not, when Trump got reelected is, oh my God, we did not, it was like we ran a marathon and we haven't recovered and now we're going to do it again, except more. It was a friend of mine at NPR used to refer to 5 p.m. as news o'clock during the Trump administration, because that's when they would drop stuff. And you had to stay on Twitter all the time because you never knew when he was going to announce something. I mean, it was just this constant keeping you off balance. That's his style. That's not changed.
Well, most of us, obviously, in the public health field, would be concerned about something like this. Do you think the general public will? How do you think the general public will react, or how will insiders react to this?
I don't know. I mean, insiders are freaking out, but the people who voted for Trump because they wanted to shake things up will look at it and say, "Oh, good, he's shaking things up," and go back to what they were doing. I mean, I don't think it takes so long for this to, trickle down to where people would notice it or feel it that I think that this is just, Washington parlor games going on with, cable TV and the media and public health experts all sort of freaking out together. I mean, the one thing I would say is I've been doing this long enough that I remember back to the first Bush administration when there was a very weak secretary and very strong department heads that, you had the heads of the NIH and the CDC and CMS who were, very, very people who became very prominent people, even if they weren't necessarily prominent people going in. So it's this, in some ways, it might be safer to have RFK Jr. as secretary than it would to have him in the White House trying to determine policy, because he's going to get so swept up into all the stuff you have to do as secretary, and there's a lot of it, that he's not going to have time to, go to FDA and say, you're going to get rid of the Bureau of Food. Or,
Yeah.
you're going to ban red dye number, whatever it is that hasn't been banned yet.
Okay, let's back up a bit. I just want to make sure everybody knows Julie Rovner is the chief correspondent, Washington correspondent of KFF News, which those of you who are students of mine know we assign all the time, and I know a lot of other faculty at Cal State OA use KFF News as a healthcare source, because not only do they have their own reporters reporting the news, like you write things and you have a blog, but they
Podcast.
podcast.
It's
Sorry.
tough.
Right. It's called What the Health, which I think is a great name, but now even more so than ever, it's a great name. But KFF also collects all kinds of journal articles and dated newspaper articles and magazine articles and posts them up every single day and links them so you can see the world of healthcare from 100 different eyes on at KFF virtually any day. I guess it's 5-6 days a week now. So I just wanted to let everybody know that and what Julie does. And we had her, many of you saw Larry Levitt on at the beginning of this series, and he works with Julie, and he works in the Bay Area, and he and I went back years ago. And Julie and I have known each other for some time, although obviously we don't work as well together, as much together as I did with Larry. Let me ask you this. Going back to maybe the politics of this, what in your view or the view of others in DC were the main factors that contributed to Trump's victory? Why do you think people voted for him?
I think people, everybody thinks, oh, you're voting. Everybody takes their mandate as you're voting for something. I think in more cases than not, people are voting against something. They weren't happy with how things were going. Ironically, in many ways, the things that they would have liked to have happened were things that were blocked by the Republicans. But they don't know that because they're busy, and they see the price of butter has doubled, which it has, starting to be baking season. Things are expensive. Things that they have to buy are expensive. Not so much gas. Gas has gone down. I don't know if it has in California. We're under $3 a gallon here in the DC area. But food
Can I
is
go there and fill up my car now?
yeah. Food is still, you probably have an electric car.
I do.
Yeah, I figured you did. Other things are expensive. Rent is expensive. Housing is a huge, huge problem, and it's a huge problem everywhere. And I think the pandemic, exacerbated the housing problem because it scrambled the population. People were no longer had to live close enough to commute where they worked, and so that ran up, but there was no building going on, and the supply chains got messed up. So I mean, I get why people were ticked off, and I think they weren't so much voting for Trump as they were just voting no, and now we're here.
Huh. Okay. I have one more question, then I'm going to ask Taylor to chime in. As I looked at the healthcare debate in the over the last election, other than the abortion issue, I didn't see all that much. Now, in the past, you and I have been through the Clinton campaign and the Clinton.
You didn't miss it.
We've been through the Obama thing, and health was a huge issue in those elections. Why do you think it just wasn't so prominent this time? And should it have been from a Democratic point of view?
I don't think either party had anything to gain from making it a big issue. Lord knows Trump didn't. He still doesn't know what he wants to do. He wants to make healthcare great again. He has no idea how, even after 4 years as president. The Democrats would basically, or Democrats were running on, let's not take away what we have. Let's keep the expanded subsidies for the ACA. We have the lowest uninsured rate, I think, in the history of keeping track. There was a CDC study this week, it was like 8%, which is just, which means that 92% of Americans have insurance. Now we have other issues, which talk about on today's podcast. There's healthcare is too expensive, the system's a mess. You can have insurance and still not be able to afford care. But that threshold of most everybody has insurance has been met. It's unlikely to stay this way, I think, 4 years from now. But, the Democrats never agreed amongst themselves. Do they want to do Medicare for all? What about healthcare consolidation? It can be more efficient, but it can also be more expensive. And, it gets super nerdy, super fast. There was not a really good, and I think until Harris hit on the whole long-term care thing, which I found, I don't know, I guess ironic, because I wrote one of my first really big features about the lack of a long-term care policy when I started covering health in 1986. But everybody was like, wow, nobody's ever talked about long-term care before. I'm like, nobody's talked about it recently. It struck a nerve, but I mean, there wasn't much for either side. The Democrats were hoping that abortion would be their silver bullet, and it wasn't.
Okay. Taylor, you have something you'd like to ask?
Well, yeah, one question that comes to mind is how would you characterize healthcare policy under Trump's first term? The main components of it, and especially how we dealt with the interest groups, or how the secretary dealt with the interest groups in this field, and then if that gives any lessons to this new term, or maybe it doesn't, because now he's just out there flying free with RFK. But I'm curious as to how you would characterize the policy
He was out there.
orientation
He
in the
was out there
first term.
flying free before. This is not new. This is
But maybe his
I
cabinet secretary wasn't. I don't know.
I would describe the Trump health policy in his first term as messy,
Mhm.
unpredictable, and sometimes contradictory. And I joke, but it's not a joke. He said Trump would contradict himself sometimes in the same breath. He wanted to beat up on the drug companies, but he didn't want to beat up on the drug companies. He wanted to bring down drug prices. He was going to do most favored nation, then he wasn't going to do most favored nation. He was going to punish women who had abortion, then he wasn't going to punish women who had abortions. Everything that came out of Trump's mouth on healthcare could be interpreted A, in 5 different ways, and B, was likely to change within the hour. It was extraordinarily hard to keep track. I think that's why everybody was so exhausted, because you can't say, well, this is his position. His position is that he changes his positions. That's what it was in the first term. I have no doubt that's what it's going to be this time too.
Do you think this is part of his strategy, or is it just the way he is? He doesn't know anything about it, so he jumps from one thing to the other.
I think it's both. I used to think it was just the way he is, that he doesn't know anything about it. But I mean, I think it's more clever than we give him credit for. That it's this sort of sleight of hand. Look this way, no, look this way, no, look this way. I do think on a lot of these sort of bigger things, I mean, is he really anti-abortion deep in his heart of hearts? I sincerely doubt it. He just knows he needs to be, because he needs the support from the anti-abortion groups. My question going forward is he gonna need to keep it? Robert F. Kennedy Jr. is not anti-choice. I actually just posted something on Twitter in the last few minutes. That's going to put a lot of Republicans in a really uncomfortable place if they actually have to vote on this. Now we see, of course, why Trump was saying he wants to have recess appointments. Would they rather recess and go home and let him, recess appoint RFK Jr. so they don't have to vote for somebody who says he wants to ban abortion after viability, which has been his position? Yeah.
What do you think is in store for public health in particular. We are a Department of Public Health here. Most of the people who are on the discussion now are public health people, not, health services people, more public health people. What do you think, if anything, is in store for public health? Does he have any view that you can pull out from all his messages about
I think
health? Does he
the-
care about it? Does he not?
I don't think he does, but well, yeah, actually, I do think he does. But I think the whole theme of this administration is anti-expertise. I mean, if you really look at him as wanting to come in and become an authoritarian, and there's every indication that he said that's what he wants to do, and that's exactly what he's acting like. And one of the ways that you do that is you undermine expertise. And where do we have expertise that's already been undermined? Public health. That's, we had 4 years of COVID, where even Democrats, continued the piling on of public health. God forbid in science you should say something and then get new evidence and say that, oh, we were wrong. New evidence suggests this is right. Now it's just, you were lying to us. The public is already primed to distrust public health. So, what will they do to the CDC? I have no idea, but I can't imagine it will be good.
Do you think the public's view of the public health agencies is solid, not so solid, damaged by COVID, helped by COVID, made more prominent? How would you view their?
No, I think it's super damaged by COVID. I mean, we're seeing, if you read about even some of these school board decisions, some of these local school board fights, I mean, everybody believes that whatever they think, thank you, Elon Musk. If you think it, you're entitled to believe that it's true. If you see someone say, well, I've read that X, I've read that you can drink bleach and it will help cure your COVID. I have doctors who say that, I should take hydroxychloroquine, which they probably do. That now we're seeing, I've noticed this whole line of peer-reviewed studies undermining other studies that have been well established. I'm thinking of the Turnaway study on women who didn't get abortion from UCSF. And I keep getting emails from these, well, we've reanalyzed their data and they're wrong because, and you look and it's completely funded by anti-abortion groups. There's, it's easy to make things look like they're equivalent when they're not. And there's nobody believes the referees. The media is, we're somewhere below public health right now. And anybody can say they're the media. We get these people who are doing these undercover investigations. I'm sorry that James O'Keefe is not a journalist, but he calls himself one. So everybody thinks that all journalists make things up or all journalists have an agenda. So it's not a great time right now. So it's certainly not a great time to be a journalist.
So how would you as a citizen, obviously the denial of expertise, the loss of credibility that experts have, whether it be public health or anything else, although I don't see hospitals necessarily losing their expertise, their credibility, or doctors losing their credibility. How in the long term can we teach people about public health, get them to see it more broadly or see it more accurately?
I wish I knew. I mean, I get asked this question all the time. It's like, this is why I'm a journalist and I'm not a policy person. You tell me how, and I'll tell them. One of the things I do feel pretty strongly about, though, is that we really need to go back and sort of re-emphasize both civics and media literacy. I think those are two things that are lacking, that's making everything else worse. I learned about the three branches of government in fifth grade, and yet people think that, oh my God, Biden overturned Roe v. Wade because he was president when the Supreme Court did it. It's like, not how it works. So, I mean, there's like really, really basic people who think Trump gets up and says, I can fix this and I can fix that and I can fix the other thing, none of which he has any power over, but they don't know that because they don't understand how the government works. So that's a big, big issue. And I think people mistaking social media for people who are actually professional gatherers and distributors of information. I think those are sort of two things that are just that allow you to be sort of led aside by people who would try to, to basically use you to accrue power. That's what we're seeing.
Would you think that's, could you expand a little bit on the social media thing? Because one of the things that certainly has come into infinitely more power than it had in the recent past and over Trump's certainly period. And he's used it, more than any precedent ever, obviously. Could you expand on what might be and tie it perhaps to your view that, journalism and traditional news and other things seem to have undergone a period of nobody necessarily believes us, but they do believe what they see on X or, something else.
I think it started on C-SPAN. I've been on C-SPAN like a million times. I think I'm actually the most, I believe I am the journalist who has appeared on C-SPAN more than any other over 38 years now. And starting fairly soon, like in the 90s, I think during the Clinton administration, I would get callers who would say, well, I'll be at a hearing or a markup or some event where I am reporting, I'm watching the event, but I'm also talking to people as they leave the room, as they come in, in background, people who are in the audience, but are part of this. Reporting the entire event. And somebody will challenge me on what happened and say, well, I watched it on C-SPAN, so I know as much as you do. That was sort of the beginnings of it. That was sort of when we got Rush Limbaugh, who would sort of twist things to his, this is what happened. You can believe me because you share my worldview. But I did start to notice people pushing back. And I'm not saying that C-SPAN isn't a wonderful thing. C-SPAN is a wonderful thing. And it did let people see things that they had not seen before and be in rooms that they had not been in before. But it didn't give them the whole picture. It gave them the TV picture. And I think Trump is sort of a follow-on to that, it's showing people. And that's why Trump is so attractive, because he pretends, he says things that he shouldn't say. So that's a quiet part out loud. He says, well, I'm saying this because I need these people to vote for me, which is like, people are wincing, but people perceive that as being a peek behind the curtain, even though it's an act. And I think it makes them feel like insiders. And so they trust it. And so when he says, those people all tell you that the sky is blue. And I know you've read in books that the sky is blue. And I know there have been peer-reviewed studies that say that the sky is blue, but really the sky is pink. They've all been lying to you. And then they start jumping up and down and going, oh, the sky is pink. I think there's a lot of that.
Kelly, you have any questions you'd like to ask our guest?
You're asking me? Yes. There's got to be a lot of very wealthy interest groups that are concerned about the appointment of the Secretary of Health and Human Services. They presumably have a lot of well-paid lobbyists up on Capitol Hill. Do you have a feeling yet about how they're going to react to this appointment? Is there going to be an effort to try to derail it? Or maybe are they going to say, well, we'll be okay with this guy because he doesn't have the slightest idea of how to run anything, and we'll just maneuver around him, as you were suggesting earlier, through the existing bureaucracy, and we'll just make mincemeat of him. Well,
Yeah.
Any thoughts on it so far?
Yeah, I think it's much more the latter. I don't think anybody wants to get in front of the moving train of, Donald Trump and his Republican Senate. If there are some Republican senators who want to stand up and get in front of that, I think they would be okay. But I think a lot of them, right now, as I say, we were literally in the shock and awe stage. Nobody thought, this would happen. I think there was a picture earlier today and on Twitter of Bobby Jindal and his wife standing on the lawn in Mar-a-Lago and waving. And, I thought, oh, here comes Bobby Jindal, which would have been a much more traditional pick, if you will, traditional conservative.
Tell our audience a little bit more about Bobby Jindal.
Yeah, Bobby Jindal, who, came to Washington in the early 2000s, worked for George W. Bush at HHS. He was the assistant secretary for planning and evaluation, went home to Louisiana where he had been the secretary of health and became the governor and was briefly touted. Actually, I think he briefly ran for president. Had one of those not very successful responses to the State of the Union, which kind of did in his national career. But he's been hanging around and he's been heading up the health part of the Make America First committee. I can never remember the name of it. The one that wasn't the Heritage Foundation's Project 2025. And he was definitely on the short list to be secretary, and he is unquestionably qualified to be secretary of HHS. So I mean, I think he's probably pretty disappointed right now. I don't know, maybe they'll make him head of CMS.
Do you have any idea what you think is in store, given the fluidity of the situation and the I don't know how to describe it, the almost intentional uncertainty of Donald Trump? What do you think might be in store for public health?
I think more uncertainty. I think intentional uncertainty is a really good phrase. I was actually about to put on social media, and Wilson, people who are trying to rely on norms, there's nothing normal about what's happening right now. I grew up in Washington. I was born here. I was born at GW Hospital. Both my parents worked on Capitol Hill. I worked on Capitol Hill. I've been covering Congress since the 1980s. There's never been anything like this. I mean, I can say that with at least my personal certainty. And I have absolutely no clue what's going to come. I'm just going to, react as it comes.
If an advocate for public health came to you and said, "What should we do? We're worried about he's going to undermine all these institutions that the public needs to rely on," what would you tell him? Throw in the towel?
Yeah, that's what I expect is going to happen. I don't mean to be glib. I mean, literally, not my job to tell them what to do. I don't know either.
Would you consider going around him, saying he's going to go all over the map, and once he starts running the government, no one person can run the government. You could talk all day long, you're not going to cover all the issues. So would a strategy for public health is just to go around him? Work on the lobbying groups, many of which support public health. They're not anti-public health, and the doctors, the hospitals aren't anti-public health. Work on them to, just work within the agencies and do the right thing and let Trump go off and, throw his hands up in the air. And would that be a strategy?
I think the time-honored strategy in situations like this is to point at somebody else. Is to hope that, take the focus off you and say, why don't you go after them? I mean, it's not very nice. It's not very polite, but it's, as you know, Walter, it's really common. It's like, oh yeah, you really should be going after this terrible thing. And it's so terrible that I'm going to leak it to ProPublica. So they're going to write a big story and it's going to get all over cable TV, and that's going to get a lot of notice. And then they're going to not pay attention to us over here. That may be literally the best that, some can hope for right now.
Okay. Well, that's a a bleak picture. Maybe we could open ourselves up to questions from the audience. Do we have any?
Yeah, we actually
thoughts
do
there?
have one
Okay.
already. We'd love to get some more if anyone has questions. What should public health do to prepare for the months and years ahead?
Develop alternative pathways of talking to people. I mean, I think that's really, my corgi and I do TikTok videos. That really is, certainly don't depend on government agencies to do things for you. And I don't mean just the federal government, state and local governments are pretty riven over this stuff too. Find other ways of connecting with the public. That would be my advice.
Okay. Do you think that Trump we've been looking at a little bit of public health, and this is of course part of public health, but do you think that Trump will aggressively try to do anything to either Medicare or the Affordable Care Act or Medicaid? Or
Yes.
would we just leave those alone?
No, we actually talk about this on today's podcast, one at a time. You can't leave Medicare on autopilot for 4 years. You just can't. You have to decide what they're going to do about, a physician fee cut of 3% that's coming unless Congress actually gets around to canceling it again. They're going to have to decide what they want to do about going forward with Medicare drug price negotiations. They're going to have to decide what they want to do about Medicare Advantage. There's too much sort of day-to-day Medicare policy that needs to be made. So Medicare not going to be off the table. Medicaid, Trump very carefully left that out when he talked about the things that he wasn't going to cut. I mean, I think we're looking at a return of, work requirements. There's going to be an effort, I think, to lower the federal contribution to for the ACA expansion population under Medicaid. There's been, again, there's talk, I think it's
both of which we should point out to the audience would reduce the numbers of people eligible for Medicaid. So he would be trying to maybe lower costs in Medicaid.
Right.
Reducing the numbers of people who are eligible.
Although reducing the federal match for the expansion population would just load it onto the states. But there are a number of states who expanded and put in their expansion legislation that if the federal government lowers the match, which is currently 90%, federal government's paying 90% of the cost of that for that expansion group, that they would cancel their expansion. So that would make those people ineligible. So that's something.
And this was part of the ACA, correct?
Yes, this was part of the ACA. This was the ACA expansion. The other thing that's going to happen to the ACA is that in 2021, the American Rescue Act expanded subsidies dramatically under the ACA, which enabled somewhere in the neighborhood of 9 million more people to afford health insurance. Those subsidies were temporary. They end at the end of 2025. If they don't get affirmatively renewed, they go away, which there's now every anticipation that they will, although there is the possibility that the states that would be hurt the most by that are pretty red states. And you might actually see some governors, say, maybe we don't want to throw 9 million people off of their private health insurance under the Affordable Care Act. That's something I'm going to watch very carefully next year. But yes, I expect Medicare, Medicaid, and the ACA all to be in play to some extent.
Speaking of that, do you think Trump's going to change the public charge rule again?
I don't know. I mean, that's
describe why don't you describe first what the public charge rule is?
If I can remember exactly what he had. It's an immigration provision that bans people from getting public to being on public programs, although I think Medicaid was not part of it, or there was some connection to Medicaid. It's vague because I flushed it out of my brain when it went away. And now I'll have to remind myself what parts were in it. But basically it says, if you come to this country, you can't collect any of our welfare programs for a period of time, however long that is. And do I expect that to come back? Yeah.
We have a question from the audience. Do you believe reproductive rights are at risk? Is a national abortion ban likely to happen?
Yes and no, and that's what I'm actually writing my column on as we speak about all the things that Trump can and probably will do to restrict abortion and reproductive health access without a national ban. Do I think Congress is going to pass a national ban? No. When Trump said I won't sign one, it's like, that's fine. They won't pass one. With a 53 vote majority in the Senate, even if they got rid of the filibuster, I don't think that Republicans would vote for a national ban. Certainly in a House that's going to be split 223 to 215, they're not going to have the votes to do that, but they don't need to. Trump has a number of ways that he could effectively make abortion, if not unavailable, extraordinarily difficult to access. He could, get RFK Jr. to get whoever the new head of the FDA is, to either cancel the approval of mifepristone, which would be unprecedented, the abortion pill, or even just rolling back to the restrictions that were in place before 2016, which did not allow it to be distributed either by pharmacies or through the mail. You had to actually go physically get it. You had to be handed the pill by the doctor, which would make it much more difficult to come by, even if it remains legal. They could also use the Comstock Act, an 1873 anti-vice law that banned the mailing of anything that could be used for an abortion, which would mean not just the abortion pill, but anything that moves in commerce that's used for procedural abortion. So, all these blue states that just voted to, protect abortion rights, that could be a protection, in name only.
Maybe I'm being naive, but wouldn't that be pushing the envelope a little too far for Trump? Wouldn't he prefer kind of to avoid those kinds of issues? Wouldn't some Republicans running for re-election off year or whatever be a little worried about those votes?
Don't know. I mean, I really don't know. And they wouldn't have a say. These are things he could do administratively. None of this, and that's what the column that I'm writing is about. None of this happens with Congress. All of this is done with executive authority. Most of it he did with executive authority in his first term, and then Biden reversed it, and he just has to reverse it back, which I have every confidence that he will do. Unless, as I said earlier, maybe he was playing the anti-abortion movement the whole time, and he's going to come out as pro-choice. I find that doubtful, but
Right.
the one thing I can say about Trump is he's completely unpredictable.
We have another one from the audience. What are your thoughts about the Supreme Court? How likely is it to see 2 retirements coming in 2025?
Likely. I mean, that, the Supreme Court has become now so politicized, which is kind of sad. I mean, from both sides, that, justices wait to, if they're thinking about retiring, they wait to retire until they feel that they can be replaced by someone, with similar inclinations policy wise. We didn't, for most of my career, we didn't have a red or a blue Supreme Court. It was always sort of an adventure to see who was going to vote which way, because those ideological, predictable rulings weren't that frequent. And now they are, it's notable when they don't happen.
They could mail it in now.
Pretty much.
Yeah. Let me ask you, how did you pick journalism as a career? And obviously you said you've been in it, 27 years now.
More than that.
What do you like about it? What's fun with journalism?
My mom was a journalist. She was actually a health journalist. So I grew up in a newsroom. I always thought it was cool. I'm really curious. I like to know stuff, and I like to know it first, and I like to tell other people. And that's basically what journalism is. You get paid to do what you like to do anyway. I have more noble feelings about it too, which is that I like to teach. I mean, I like to explain. I like to learn how things work and then explain it. And that was one of the things that sort of attracted me to health policy, which I got into by accident. Went to work for Congressional Quarterly in 1986, and that was the beat that they gave me. So I covered health, welfare, and government operations. I mean, for a while, you could ask me anything about the federal pension system, and I could tell you. I don't think I can anymore, but I covered the transition from the old federal pension system to the current federal pension system in the late 1980s. That was part of my beat. And I feel really strongly health is something that affects every single American in a really intimate way. And I really feel like people should know more about it. And I feel like it's not just my job, but my mission to help explain it to people.
So do you feel it's more important now, say under a Trump presidency, or the direction the country's been going, that it's more important that we have quality journalism out there, or you feel you're running against the wind sometime?
I feel like it's always important. I mean, that's why I'm so sort of depressed by the state of journalism, by the idea that people, that they get their news from TikTok, and they believe influencers who are being paid by somebody to, to shade something one way or the other. I mean, I am being paid to basically tell what I see happening. I'm not paid by the Republicans or the Democrats or or anybody else or industry. Basically, my allegiance is to the audience, and to tell them what they should know, or at least what I as an educated person, as an expert in this field, what I feel like they should know in order for them to make good decisions.
And if you were to stepping out of the journalism world to maybe, and maybe this is more my past than yours, but if you were an advocate and you were concerned about what might be going on now in our country and even in the world, most of obviously our audience are students. What would you tell them? What's your message to students about what to do under circumstances like this?
I think one of the things I can say, not being an advocate, but just being a longtime observer, is that, you know, things change. I mean, you know, things that look really bleak turn around. I mean, one thing we know about politics these days, I have never seen the majorities in the House and Senate change as rapidly and as frequently as they have in the last 20 years. I mean, when I started covering this, the House had been Democratic for 40 years. I mean, there was just never any thought that Republicans would ever be able to get a majority in the House. So that, you know, that if you get involved, you can make things change, and things eventually do change. It takes a long time, but you know, if you really believe in something and you're willing to fight for it, you can make things happen.
And if you don't want to sit on your duff and wait for things to happen, what might young people do today? What options are there that might be profitable or valuable in terms of whatever they think influencing the times? A lot of people just sit back and say, well, I'm just one person. What can I do? Probably nothing as one person, but what
I
can
mean, that, you know, one of the nice things about social media, there are a few, is that it's easy to find like-minded people who believe in the same things that you believe in, and who can, you know, form groups to, you know, we still, at least for now, have a democracy, and you can talk to elected officials at whatever level, and exert your influence and go out and knock on doors to get, if you don't like the person who's representing you, go out and knock on doors to get someone who you think you'll like better and who will support what you believe in. I mean, it's not, some things have not yet changed, and you're still free to sort of go out and pursue. You know, I tell people sort of to find the things that they're passionate about and follow your passion.
Well, I just want to also mention that Taylor, I know, was talking earlier about organizations and interest groups a lot. I mean, one thing, obviously, that I think students and others can do is find a group that you agree with and go volunteer, get a job with them, pitch in what they're doing, whether it be the environment or whether it be healthcare or whether it be transportation or violence or crime, whatever it is. And get involved there. There are lots of organizations out there doing everything you can imagine. Just find one, and most of them need volunteers and helpers of all kinds. So that's often a good place to start. Too often people think, well, I'm going to run for public office, or I'm going to help a senator or a member of Congress. You can do that too, but there are hundreds and hundreds of groups out there in every range of activity, and find one. I always say find one and get started there, and then see where you go. Taylor, do you have anything else you'd like to ask before we wind down here? I lost Taylor.
Sorry, just trying to get my sound back on.
Okay.
Yeah, I have to come back to this case of Robert F. Kennedy Jr. And I don't know, I'm curious, I don't know how much you followed his worldview or his ideas.
Lots.
What?
Lots. I have
Lots.
followed
Okay, because then
lots.
I'm curious because
You listen to the podcast, we've been talking about him pretty much all year. So
okay,
I
well,
feel
great.
a little bit validated in some ways.
Yeah, when I listened to him a little bit, I mean, he says these things about vaccinations that seem very dubious, but then he does get into other areas about, problems that we have in our society with ill health and, diabetes and obesity and the quality of food that seem pretty sensible. And so I wonder what might be like the best case scenario if he were like conceivably were he to become the Secretary of Health and Human Services. Because we could look at the bad things, but I wonder what might be something hopeful or good. Of course, that's a value-laden question, but that might come out of his administration.
One of the things that a lot of Democrats are taking sort of some solace from is his position on industry influence in the food and drug realm. I mean, not just the FDA, but sort of, their influence among regulators. I mean, it's we talked about. Go listen to this week's podcast. We talked about this morning on this week's podcast, that, generally this administration's thrust is anti-regulatory. It's like, we need to unshackle industry from, the yokes of government regulation, unless you're Robert F. Kennedy Jr., who thinks that the industry has way too much influence in government, in Washington in particular. And there's a lot of Democrats who completely agree with that. He sounds like Bernie Sanders when he talks that way. So, I mean, he's a very interesting choice. I mean, it will be, there's a lot that both sides will really dislike and a lot that both sides will like about this. And it's one of the reasons why we've talked about him so much all year.
Yeah, it's quite remarkable because, we live in this polarized age, but somebody like Robert Kennedy doesn't really fit into the existing polls. He
does a little bit in the
Yeah.
sense that, particularly for the anti-vaccine movement, which I've watched for 30 years, it's been, I consider it this sort of circle where the far right and far left come together, that the anti-vax movement is made up of people who are very far left and very far right. The very far right don't trust government, the very far left don't trust the industry. That's basically where they cross. So he's got a little bit of that. He's sort of he's one person encompassing that.
And
Yeah.
how does it work generally in your experience between a head of an agency and the president? To what extent there's always been my perception that presidents have their people in these various different departments. And if you go back to reading Richard Neustadt's Presidential Power decades ago, which you may have read.
As a political science student.
As a political science student, one of the things he said is presidents always guard their power. So if I were president, I'd make sure I had somebody in HHS who was watching out for my stakes, right? And Robert Kennedy may be okay on some things, but I don't want him to go there. How do you imagine those connections?
Oh, I think, having talked to secretaries and ex-secretaries going back this is something that over the last 7-8 administrations, every successive administration, Democrat or Republican, has been notable that the White House has exerted more and more and more and more influence over the secretary and the department. That secretaries basically have, I think, less power than ever before. I mean, at this point, the HHS secretary is something of a figurehead. I think Kennedy would have had more power if he'd stayed in the White House.
Yes.
I'm actually a bit surprised that he wanted to be secretary of HHS, because it is a place that he could be isolated with a platform but no power, which is what basically the HHS secretary has had for the last 8 or 9 HHS secretaries. I mean, Alex Azar, I was on a panel with him last year at Aspen with Azar and Kathleen Sebelius and Becerra, who was the incumbent at the time. And Azar, who had been the deputy secretary earlier, talked about how, you get like 1 or 2 things to be your secretarial priority, and you have to guard them with your life and do them fast because everything else is dictated for you.
And over the years, the White House staff has grown and grown and grown. And I think one of the rules of being a secretary, or one of the rules of a high-level administrator, is just make sure that if you do something major, the president isn't going to get upset.
Yes, and as we know, Trump is not shy about firing people.
Right. So I think that also holds people in check. So. All right, well, this has been so great to have you with us and to give us all these insights. And
I feel like I'm going around telling people all these bleak things and they're thanking me.
Well, tell us a little bit about your podcast. So, or your you call it your webinar, whatever it is you run, that What the Health I mentioned earlier.
It's called What the Health. You can get it wherever you get your podcasts. We're on Spotify and Apple Podcasts and and everywhere else and on YouTube. And we have a panel of reporters every week who talk about the week in health policy news. And we have guests most weeks. We actually don't have a guest this week. And if you're interested in health policy and what's going on, it's a great way to sort of catch up in, 35 or 40 minutes every Thursday.
So if I'm teaching a class in health policy, I could just put them on to every week. You got to watch this show.
Most health policy professors do. I run into lots of people who said, "Oh yeah, I started listening because my health policy professor assigned it to me."
Thank you all for joining in, and Julie, thanks so much for being with us. This was
Sorry again, I was late. It's the woes of the news business.
You were late. I kept telling my she will be here. I'm sure she's on deadline, and look at what's happening. What has to take precedence?
Yeah, it's been a couple of days.
Okay, well, it's great to have you with us, and thanks, Joelle, for
Thank you.
and Taylor for being with us, and Greg for helping support this whole effort. So we'll see you all soon, hopefully next semester. Take care.
Thank you.
Bye-bye.